Here is another kidney. You could recognize that instantly by eyeballing quickly some glomeruli and some tubules surrounding them. You can see a large blood vessel here. You can see a hyalinized glomerulus right next to a non-hyalinized one. You can see a blood vessel here. You may see some scattered inflammatory cells within the interstitium. And so far, we are not terribly excited. However, when you move across this little fibrous separation here, I don't think it's a blood vessel. I think it's kind of a fibrous capsule. You once again see a bunch of cells that have small, centrally located nuclei surrounded by abundant foamy type cytoplasm, which may look yellow grossly. And this is another classical renal cell carcinoma or clear cell carcinoma or hypernephroma, which is the commonest type of kidney cancer. What I want you to notice from this picture, however, this case, is that let me ask you this question. You know this is tumor here. You know these are tumor cells scattered throughout here as well because they look the same, don't they? But in addition, look how vascular this tumor is. Probably over 50 to 60% of the cross-sectional area of this tumor is nothing but distended blood vessels in which there is an abundant amount of blood present. Perhaps this might be the reason why many renal carcinomas go directly into the bloodstream. And of course, the renal doesn't really have lymphatics in it either. That might be another reason. But the earliest sign of metastasis or invasion from a renal cell carcinoma would be to look at the renal veins. And if you see tumor in the renal vein, you could probably bet it's already in the lungs or the brain or the bone. But I wanted to show you just one more time how these tumor cells, which are small nuclei surrounded by abundant amount of cytoplasm, are so much interweaved with these vascular spaces all over. Also, please notice that for as nasty as this tumor is, the nuclei themselves look small and uniform and regular. From a cytologic point of view, period, you might not suspect this was malignant if you just zoomed in on an individual cell. And even an experienced pathologist taking this cell out of context could very easily call it a macrophage or a lymphocyte or a plasma cell on a bad day or even on a good day. Thank you very much.